This is for the men, strictly for the men. This is for the men.
And the women who love you.
This is for the men, strictly for the men. This is for the men.
And the women who love you.
Hi, I'm Tiffany.
And I'm Camille. And we are Black women committed to seeing Black men live healthy lives. This is the We See You podcast. And it is a podcast where we discuss topics that affect the health of men in our community. We want to thank the Bobby L. Roberts Library of Arkansas History and Art, Central Arkansas Library System, for letting us use this space to record this podcast today. So I guess the first thing with this podcast we should talk about is why us? Why are we talking about Black men's health or men's health and we not men?
That's probably a good question. We probably could have found some men to do it. But for the last, 3 years, we've been out across the state of Arkansas working with men, Black men specifically, about their health. And we've been hearing their stories. We've been hearing them talk about what helps them be healthy, what's making it hard for them to be healthy. And so we've learned a lot. And I think from that learning that experience, we've learned, too, that Black men are some of the last people who get the information about how to live healthy. We do great outreach to women. We do outreach to other communities. We don't always do this outreach to Black men. And so in this time where, good information about health is kind of hard to come by, we want to make sure that we're part of the solution. And we want to be, out here getting the information to the people who need it the most.
I think that hits it right on the head, the nail on the head. We know Black men. We have Black men who are close to us in our lives. And we, like we said, we want to see them healthy and thriving. This isn't a place where we're going to bash men or anything like that. Like, we really come from a place of love and care and wanting to be there to support the men in our community. So I feel like we should do a little bit more like a deeper introduction of ourselves so people know who we are.
Okay.
Besides just Tiffany and Camille.
Okay.
So who are you and what makes you qualified to have this conversation about Black men's health?
Listen, I'm not going to say we qualified. I'm going to say that we passionate, and this is kind of like what our purpose is in this season. But the other thing I think that makes me qualified is I am a clinical psychologist by training, and I'm a mental health researcher. So that's how we've been working with men in the community, because we've been out here with a funded research study about alcohol use in men and how we can decrease that in an effort to decrease cancer and cardiovascular risk for men in Arkansas.
Okay, and I am a public health professional who's been working in this arena for over 10 years officially, and I love men. I do.
That's beautiful.
Yeah, I mean, y'all tell me all the time, you will love men. So.
She does.
I have some in my life that who I want to make sure are healthy, and I have these conversations with and with friends, and we've been having these conversations through the work that we do and have found it very rewarding with what we've heard from the men that we've met with. And then, and this isn't just something that we came up with. Like, they actually said, like, hey, y'all should do a podcast.
Yeah.
So it's not that we were like, oh, we the people who need to go out and talk about this. No, people told us this is what's needed, this is what they want. And so trying to give the people what we think they want for what they saw. I hope they like it. But, who knows? I think one of the words that we've talked about is like our profession is public health. Public health is everybody doesn't know what public health is. Like, I feel like people have heard it more now because of the pandemic. Mm-hmm. But before then, people didn't really know what public health was, and they probably still don't.
Maybe not.
So I feel like we should let the people know, like, what public health is.
Okay.
So to me, the way that I remember talking about it in school was that when you go to the doctor, most of the time you go to the doctor because you're sick, you're not feeling well, and you're going to them to help you feel better. I mean, you can go to the doctor for preventative things, but most of the time we only go when we got a scratchy throat. Yeah, my back been hurting for 6 months.
And it's usually when something is really wrong. So, like, you don't go for the scratchy throat. You go for when it's burning, you can't swallow.
That's true.
You can't talk. So, like, we go when it's bad. Like, there's no other option.
That's very true. Yeah. And then public health is about the preventing people from getting sick, helping people stay well, and it involves not only our healthcare, like going to doctors and dentists and people like that, but it's also like our environment, sidewalks in our communities, if there's sidewalks, because we know if there's sidewalks in the community, that means people probably walk around more because they feel safer. Street lights, our food handling, that's all part of public health. Our waterways, everything is public health, from your physical, emotional, social health. Our communities, being a community is part of public health. And I think when we realize that and we all can work together towards it, and understand that's what we're doing, then, we're actually all public health practitioners.
We are. And I think that, public health is this part that you don't see. So we see the doctors, we see the people out here who are doing the treatment. The public health is the part that you don't see, but if it doesn't work well, you're going to know it. So when we had the pandemic and things kind of fell apart, we knew when public health wasn't working well. But when it's working well, you don't even know what's going on. It's just, it's just there and it's working and it's holding up the health of our community.
Yeah. Well, going back to our topic at hand, which is men's health, why is it important to talk about men's health now?
Well, first, we are dropping this in June. And June is Men's Health Month.
Yes.
So I think that it's great that we're having this conversation around the time where we're, talking about men and kind of highlighting men and men's health. I think that another reason why this is important, I think I mentioned it earlier about how men are getting this information last. But when we're talking in the community to men, they're focused on the grind and providing and doing what you got to do and to provide for yourself and for your family and to be a man in that way. And so their health is at the bottom of the list. Mm-hmm. And really what happens is that when your health is at the bottom of the list, we go years and years and years and we're doing damage to our body, and then we don't realize it until sometimes it's too late, or it takes a lot more for us to be healthy. And so we really want to start talking a little earlier, because when we have healthy men, we have healthy families. And healthy families, we have healthy communities. And so having our men step up and say, you know what, I'm gonna take care of my health so I can be here for my kids, so I can be here for my parents, so I can be here for my family and friends. That's important, because it's going to ultimately, us focusing on our health is going to make everybody around us also healthier too.
Yeah. And I think another thing, that when we are going through life and doing things and maybe participating in things that don't contribute well to our health, we don't think about in the future how that can affect our quality of life.
Right.
And quality of life is important.
Right.
I want to make sure that, when I'm 70, 80, 90 years old, then I'm still able to get in and out of car easy, not have to walk with much assistance, if any at all. Mm-hmm. And a lot of that has to do with what we do early in our life. Mm-hmm. And how we take care of ourselves. So I feel like you said, like, having these conversations and thinking about these things hopefully will help improve the quality of life. Think about our quality of life and what we can do to make that good.
And when you said that, it made me think, because like my dad is 75. He'll be 76 like in another month or so, and he still walks probably 3 to 5 miles a day. Like, he walks every day, and he's been doing that probably since I was a child, like walking, and he still gets around pretty well. And there's other people that are his age that do need help and are not able to get around, and or maybe housebound or things like that. But he, not to say that he's completely healthy, that he has some health issues, but even keeping active and doing those things, he's able to enjoy his grandkids. He's able to still travel and do those things, and that's really important. So I think we think about life or death, and we don't think about that quality of life, which is really important. Like, you want to be able to walk and move.
Right. And now, you're saying that your dad's in his 70s. Quality health, this starts, even earlier than that. We hear about people who are in their 30s, 40s having strokes and things like that. And different things contribute to people, especially men having those issues. Stress, mm-hmm. The stress of life, stress of family, all those things. And so it leads to, someone getting sick and then being on disability for 50 years and not having the quality of life that they thought that they would have, because they can't get it around as easy. And, you hate to see it go into a nursing home and you see somebody in their 40s in there.
We don't even think about that.
You don't think about it, yeah.
We don't even think about that. But even like, they had that challenge where you get on your knees and can you jump up from your knees? And it's like, there were 40-year-olds and 30-year-olds who were like, oh, I can't do that. And then there were like some 50 and 60-year-olds like, oh, yeah, I can do that. So it's like sometimes even things like that, it all has to do with the habits that we're building earlier.
Yeah. Mm. I can't do it. I might try though. I might try. We wanted to before we get to our next segment, I think we need to thank our barber partners who we have been working with over the last 2 years, who have just been great partners for doing outreach to men. We wanted to reach men where they are, because a lot of times men, specifically black men, find out health information late. They're the last people to find it out.
Mm-hmm.
So, we've been partnering with barbershops around our state, and we just want to thank y'all and hope that, you are showing this in the shops and helping us premiere it there, and hope to continue this relationship into the future.
And I think, not only are we hoping, we know some of you are going to be showing this in your shop and sending the link out to your customer base and making sure that they know about, health and what's going on in the state and where they can get help if they want to live healthier lives. And so just your commitment to not just being an amazing barber, but your commitment to making sure that the men you come in contact with are healthy, we applaud and we celebrate you for that.
Yeah. All right, so let's move on to our next segment, which is Black Men, we love you, but whatever. In this segment, we talk about some health information that could be useful. Black men, we love you, but y'all don't be going to the doctor.
And I don't want us to come off like we just bashing the men, because
no, we're not.
There's a lot of us that don't go to the doctor.
Right.
But when we talking, there's times so what we do in barbershops, so we do these screenings, and we may say, hey, this is going on. You might want to, can we connect you to a doctor? Can we connect you to somebody? And so we'll give them that information. And then, we'll ask them, hey, did you do that? And they're like, no, I ain't go. And it's but why? And there's lots of reasons that they give us for the why. Some of it is just, it's hard to connect with doctors here in the state. We just don't have a whole lot of them. We think we have a lot of them, but nationally, we're at a shortage of primary care and specialty care. So, if you don't live in Little Rock, if you don't live in Fayetteville, maybe Jonesboro, you got to drive to get care sometimes. And sometimes, even if you are getting the preventative care, 3 months, wait about 3 to 6 months to even get in. So it's hard to get medical care here in Arkansas.
Yeah, and we get that.
Mm-hmm.
It's hard to, some people say that well, I want to go to somebody who looks like me, who understands what I'm going through. And that makes a lot of sense, because there's bias in the medical system. Not saying that everybody is, but something it is easier to talk to somebody who you feel can relate to you and what you've been going through, who knows, what you like to eat, who knows what neck bones are.
And that's what we hear, all the time when we're talking about going to the doctor, because they, there's set things that they tell us about diet, and they say reduce your fat, reduce your sodium, those type of things, and then we get home and it's I don't even know what to do with that information, given how I've been eating since I was born. Nobody in my family knows how to cook greens without ham hocks. So, how I don't even know what to do with this. And so having someone who's able to say, here's how you can keep your macaroni and cheese and have it in moderation, and here's how you can still have your barbecue on Memorial Day and it'd be okay. That's important. Mm-hmm. But that also makes it harder to find a doctor here, because we already got a shortage and we have even fewer people, doctors of color here in the state. So if you are waiting to find that doctor that looks like you may be waiting even longer.
Yeah. And so I just want to point out that we're not only talking about medical doctors, also we talk about people dealing with depression, anxiety, or something like that, and wanting to talk to someone in the mental health field and wanting to talk to somebody who looks like them, and how difficult that could be, finding someone. But to say there are people out there, but we understand it's tough to find. It's hard.
It's hard to find, and sometimes even it takes a while, right? So you're ready to go to the doctor tomorrow. You I'm leaving. I'm listening to this podcast. I'm okay, let me go get my numbers checked out. I'm ready to make an appointment, and there's a wait, and you can't get in. And then by the time you get in, you're I don't need it now. I feel fine. Mm-hmm. Or you think about the cost, because if you don't have insurance, there's a cost to it. If you do have insurance, you're probably going to pay a copay. And so it's hard to justify when we're making decisions about bills and what to pay. It's hard to justify a $35, $40 copay when that could be going towards a bill you got or something that you have to pay right away when you don't feel bad. And so it's hard to make those decisions about prioritizing my health when all these other things in my life are also, I got to, take care of all this other stuff too.
Right. I think about another reason people may not go to the doctor is they don't want to know if something wrong. Like right now, I don't know if nothing's wrong. So, and if I find out, that may make it quick for me, to get sicker.
Yeah.
And because you hear about people like, oh well, they just found out they had this condition, and then then all of a sudden something happened, and so it's like, well, I would just rather not know. What do you say to people who feel that way?
I get that. I think it's emotionally it's easier for us to pretend like everything is okay. But a lot of times we know when things aren't okay. So even if we feel okay, I think sometimes we have just learned how to push through when we don't feel our best. And so we'll say, I feel okay, but we haven't felt great in months.
Wow, yeah.
We haven't felt great we haven't just got out of bed and be like, you know what, I feel good today. And so we've just gotten used to feeling okay. We know when something is kind of off. And I get it. Like sometimes I'd be like, I don't want to have to go. I don't want to have to go to the doctor, and they'd be like, you need to lose 20 pounds. Like I know that's what they're going to say. Yeah. I don't want to go to that. Or, we do hear the stories of people who they get a cancer diagnosis and then they're gone very quickly. And it's like, well, if they didn't know, then they would have, or, they get really sick because of the treatment. And like, well, I could have just been out here living. Or you have other people who say, like, there's nothing I can do. When it's my time to go, it's my time to go. So I'm just going to live my life. And I think that, we also, again, have to remember how that impacts everybody around us, too. And so if when you have kids or when you have family, parents, and when you have friends, and, you can be like, oh, well, when it's my time to go, it's my time to go. But what about who you're leaving?
Right.
And what legacy you're giving them? And so, sometimes we have to think about, like, do I want to be able to be here longer for my child? And so if I do, then maybe going to the doctor and getting this information, maybe there is something I can do about it. Maybe there are some treatments that are different. There's things that are happening every day, and we can't even make good decisions if we don't have all the good information.
Yeah, that also makes me think about sometimes, like you said, that we know we're not feeling well, but sometimes we've been feeling bad for so long, we don't know what it means to feel good.
Right.
It's become our norm, and so you're just like, oh, I'm okay, so I don't need to go to the doctor. I've been feeling this way. I just get dizzy sometimes. I just keep on going. Like it just happens. Yeah, it just happens. It's my norm. No, that ain't normal.
That's not normal.
go talk to somebody, get that checked out. That's.
Or like sometimes you have your knee hurts or your ankle hurts, and you're like, well, I'm just getting older. And when you get older, you get aches and pains, and that's what I've always heard. Like as you get older, you just get aches and pains. And then sometimes you go and you're like, oh no, there is actually something wrong with your knee that we can give you something for, and your knee will feel better. Oh, this ain't just something I got to live with. I can actually do something about it. But again, we can't make decisions if we don't have all the information.
Exactly. So, how do you suggest people get that information? You said, like, we don't know what to do if we don't have information. Where do you get that information?
So I think that first thing, like, here in Arkansas, a lot of us don't even have a primary care physician. We don't have a doctor that we go to on a regular basis, at least once a year. But if we have a chronic illness, like diabetes, like high blood pressure, asthma, then we should be going multiple times a year, at least twice a year, if we're under control. So we don't have that person that we go to all the time. A lot of us, we get our care, urgent care or emergency room. Like when it gets bad, then we go to one of those things. So let's, I think the first thing is, like, let's think about getting a primary care physician that knows me. They know my history. They know my family history. And they're able to follow me so that when I start saying, oh, I feel a little different here, they can look back and say, okay, this is something that's not, unusual for you. And you got this type of history, so let's run these type of tests, or let's look at this a little bit more. So I think, like, getting a PCP is something that we can all try to do. And I get, too, that, like, it's hard. It's hard. If you have insurance, you can start by going to your insurance company and looking up who those primary care physicians are. If you don't have insurance, there's the community health clinics here in Arkansas. That you can go to and kind of get care in those types of places. So I do know it's hard, but that's one of the things, I think that's one of the conversations we need to start having in our families. Like, wait a minute, do you have a primary care physician? Like, when you're out there talking to your boys, like, do y'all go to the doctor once a year? Like, do y'all go? Like, what are y'all doing for your health care? So, like, at least let's start talking about it so everybody knows that this is something that we should be working towards. We may not be able to get it right away. It may take us some time to get that primary care physician. But this is something we should be working towards as a community, that we are prioritizing our health in a way that we're getting information from a physician at least once a year to let us know and follow up like how we're doing with our health.
Okay. And like in the meantime, because we just talked about like it could be take some time to find that primary care physician. It was also called PCP. That there's a lot of health fairs that are going around all the time at community centers, neighborhood associations. The Arkansas Minority Health Commission has a van that goes around the state, and those may be some good places to go and get your baseline numbers. And that's like so like where you start. And so when you do find that PCP, you go back and you'll be like, well, this is what my cholesterol was back in 3 months ago when I went to the health fair, and what is it today? Has there been a change? Or is it the same? What do I need to do to make it better? Or am I in good shape? And so, and usually those health fairs, they provide free services. They're going to have this is in June. In June, they usually have a Juneteenth here in Little Rock. And so I know they do, they have a health village there where
and
they do screenings.
Mosaic Templars is going to have the health village. So if you're in Central Arkansas around, it's a Saturday before Juneteenth?
Now, I'm not sure. I should know. I can't remember right now.
It's usually on a weekend, so it's usually on a Saturday. And you can come up here and get your blood pressure checked. Usually they'll even do like blood glucose, sometimes A1C checks, so that you kind of know those baseline numbers. Also, when school comes back, there are going to be lots of back to school fairs, and they're for the kids, but usually there's some nurses there, and you can do like, hey, check my blood pressure too. So again, you have those numbers and because sometimes things like blood pressure and diabetes, we don't know that they're creeping up or they're getting to a place where they're could be dangerous because we're not checking them often enough. So we're doing damage damage is happening in our body, and we don't even know until much later. Whereas like a little check of like where your A1C is. Oh, this A1C is a little bit high. I need to start making some lifestyle changes so that I can get this down and get my blood sugar under control.
Yeah, that's so true. This made me think about one of my family members recently found out that they were diabetic, and it's because and what made them, they were not feeling well, but they was pushing through. It's a young man in my family, was pushing through, and they were talking to another family member, and the family member was like, "Hey, you don't sound good. You need to go to the hospital." And they're like, "No, like I gotta work, gotta make this money, I got these bills." And they're like, "No, you really don't look good." Went to the hospital, ended up in the hospital for a few days, and finding out like their the blood sugar was very high. And so now knowing that, they're able to make some life changes, to take care of themselves, but it had got pretty bad.
And I think sometimes, because we hear this from men, and this is what we've been hearing, like I gotta go to work, I gotta provide, I gotta make this money. And what we don't realize is taking the 2 hours out of our time to go to the primary care physician when we can, and getting those checks on a regular basis, usually costs us less money and costs us less time than if we have to go to the hospital.
Yes.
So if we wait until our blood sugar is 500, 600, and they got to hospitalize us, the bill that comes with that, and the time that comes with that, the time off work that comes with that, and by the time your blood sugar is at that level, you're not even functioning well at your job. So you may not even be as productive. Your boss may be looking and saying, you're not keeping up the way you used to be. And so you might be having some issues at work too because we've let it go on so long. So sometimes that's what prevention does. It's like in your car, all my men friends, they're like, you need to change your oil. You need to go make sure you get a check. And you need to look at these tires. You need to be checking these tires. It takes less time for me to go to the shop and say, hey, can you look at my tires, than it is for me to be on the side of the road because I have a blowout and now I gotta wait to get told, or I gotta wait somebody else
Yeah.
to come and change my spare, put my spare on. So all of these things, the more we can do preventative, it costs us less in the long run.
That is a good point. I had never thought about our health being kind of like you do preventative care for your car, you keep your car up and running.
Yeah.
But we already do that for ourselves.
And because we think that, like, a lot of times though, we've watched so many historically, especially when we're talking about with Black people, going to the doctor for preventive care was not even an option.
Mm-hmm.
So like we just didn't have that option. So we learned how to push through and how to make it. And so we've seen in our families people never go to the doctor.
Yeah.
We've seen people in our family go, when they got really bad. My mom talked about when they never went to the dentist until it was time to pull a tooth.
Mm.
And so like you've seen this, and this is kind of how we've grown. So we don't think about the importance of that. But we've seen people be on the side of the road because their car stopped.
Right.
We've probably been in a situation where our car wasn't working, or we had a blowout of the tire, or ran out of gas. So we've had those situations happen. So it's more in our mind that that's a possibility. Whereas like you getting sick, it's kind of like that's a possibility 10 years from now, 20 years from now, not right now.
Well, it's not going to happen to me.
Well, it's not going to happen to me.
Yeah. Okay. So, I mean, let's wrap up this segment. And, with this segment, Black Men, we love you, but we don't want people to leave listening to this podcast and be like, okay, so what am I supposed to do? What is the call to action? Like, okay, when you turn this on, when this goes off today, what should someone feel like, okay, this is what I'm doing, this is what I've been encouraged to do?
Well, first, I think we want you to sit down and think about your own health. When's the last time you felt great?
Mm.
Not okay, not good enough to make it, but like you felt great. And then like, when's the last time I've been to a doctor? When's the last time I had my blood pressure, my blood sugar, my cholesterol? When have I had that blood work done? And if it's been longer than a year, then we want to start working towards getting in and getting that blood work. Whether it's going to be at an event, a community health fair, at a screening, or if you're going to try to get into a primary care physician, we want you to start thinking about moving that way. So if it's been more than a year since you've been to the doctor, now I want you to start thinking about, okay, how do I get into care so I can get these numbers, so I can see where I am, so I have all the information that I need. And then I think that we want you to start having it. If you are like, no, I'm good, I had my checkup, I got my doctor, talk to the other men in your family. When's the last time they went? When the last time you asked your boys when y'all playing spades or whatever, when the last time y'all been to the doctor? Do you know what your A1C is? Do you know what your blood pressure is? Because I want you to be around so I can whip your tail of spades next year. So like, come on, let's encourage the people around us to also be on the same track and prioritizing our health. So look at ourselves first, and we all gonna, like, whenever I feel great, what do I need to do to change that? And if I haven't been to a doctor, how can I get closer to that? And then making sure we involve everybody else in the conversation so that we're all working towards health.
So our next segment this is our praise segment.
Ooh.
And this is what kind of inspired, this is what inspired the name of this podcast, We See You. And so this segment is called We See You. And this is a chance for us to just shout out somebody, a man who we see you doing well. We see you taking steps to do something great, achieve something, or do something that may have been difficult to do, but you can do. And, we're opening this up for people to submit your We See You to us. So you can send your submissions of We See You to weseeyouPod@gmail.com. And that's all together. weseeyouPod@gmail.com. And so this is your chance to praise a man that you are proud of for making a change or doing something great. It could be related to health. It doesn't have to be health related. We just want to give Black men their flowers because they deserve flowers too.
And I think, it's important to say that, like, when we talked about that men told us this was important, they talked to us about, like, we don't ever really get a lot of people saying, what, you're doing a good job. Or, I see what you're doing out here. I see you trying. I see you doing that. It's always, like, what you need to be doing differently and better. And so we want to just take time out each time we come to just say, hey, we see y'all out here trying. We see y'all out here making efforts to be healthier. We see you making efforts to, get your grind up. We see these things, and we want to celebrate with you and celebrate those people around you. So please send your people in. It could be folks you know. It could be somebody that you don't really know, but you saw them in your community. We want to be able to shout out men and just say how much we appreciate and celebrate the moves you're making in the community.
All right. So our first We See You, we're talking about, we thought we should do somebody that people may know of.
Mm-hmm.
And I think it was probably about maybe almost a year ago now. I was listening to some podcasts, and this came up, and it was Darren McFadden. And I was like, oh, there go Darren. If you don't know, Darren McFadden is a former American football running back. In
Arkansas.
But he also was in NFL.
Yeah, but we claim him. He Arkansas.
Okay.
He's a Razorback.
Okay, he's a Razorback. Okay, I was getting there. But, we want to say we see you, Darren McFadden. And the reason why is because in November 2023, he shared on social media that he had been struggling with mental health and excessive alcohol use since he retired from playing football in 2017. And he also acknowledged that alcohol abuse is a disease. Because sometimes people will be like, people don't see it as a disease.
Right.
It's just some issue that somebody has. But it's actually a disease that can get treated.
Mm-hmm.
And he went out and got treatment. He thought it was something he could handle on his own, but once he saw how it was affecting his family, because he had a few run-ins with the law, he was like, okay, no, I want to change. I want to be better for my family. I don't want to see them going through this. Because a lot of times when we're not taking care of our health, it don't only affect you.
It affects everybody around you.
Everybody around you. And so he ended up going to an intensive outpatient treatment place and has been doing well. And so, Darren McFadden, we see you. You had the courage to open up with the public about your struggles to help others going through something similar. And we thank you for that. We see you.
We see you.
All right, so I think it's about time for us to wrap it up for today.
And so we want to thank everybody for listening to us. We promise we're going to keep these short. You can follow us on social media at some point, so be watching out for that. But if you have any thoughts or ideas and you want to send them to us, you can reach us at the email address, weseeyou.pod@gmail.com. We hope to do this at least once a month so that we'll be able to kind of keep up with things that are going on. So if you have some health topics that you want to know more about, we can bring guests in. It won't just be us all the time. It'll be us bringing in people to give you the information that you need. So we thank you so much for joining us and listening, and keep us, subscribe to our YouTube channel. Make sure that you're listening so that you can keep up with what we're going to be doing, because this is just the start. So that means it's only going to get better from here.
Yeah. And share this. Share it with others.
Share it with your people. Until next time, Black men, we see you.
We honor you.
And we need you healthy.